Welcome back to the Complete Health Australia podcast. I'm here with Timmy Chu, our dietitian. Welcome back.
Thank you, Tishan. Thanks for having me.
No problem. Thanks again. So I know that you mentioned in your first video about very low calorie diets. So that's what we're going to talk about today. Can you tell me a bit about what's involved?
Yes. So very low calorie diets or very low energy diets, depending on how you want to name it. Basically, it's a strategy that I use quite frequently with my patients. Essentially, it's keeping your calorie intake less than 800 calories per day.
Right.
We combine that with quite a very low carbohydrate diet, and that induces the body into a mild state of ketosis. Okay, and it can be quite effective to put in place for patients for short periods of time. It's not something that they do forever, so it might be sort of a 6-week program, 12 weeks. It is something that can be put in place for a longer period of time, up to 3 or 6 months, with the right supervision and if it is necessary.
Okay. Is there a reason why it's 800?
So 800 calories is important because you want to keep the body in quite a restricted calorie intake.
Yeah.
Reducing the calories that low, as well as combining a low carbohydrate diet, promotes the body into a state of ketosis, which means the body has to burn fat as a major source of energy rather than carbohydrate.
Yep.
Ketosis is quite interesting because it actually suppresses the body's appetite whilst it's in ketosis. So not only are you burning fat for energy, but your appetite becomes suppressed as well.
Oh, wow.
Another interesting thing about being in ketosis is that traditionally when you restrict calorie intake, when you try to lose weight, the body tries to fight this. It actually tends to increase hunger, and it also tends to reduce your body's metabolism.
Right. Okay.
But there's something about ketosis that it actually doesn't happen. So
that's interesting.
And so that's why it's often quite patients do get some quite good success whilst being on that sort of protocol.
Right. Okay. So just going back to that, does it involve cutting back quite a lot of different foods, or?
It is quite restrictive.
Yeah.
So in terms of cutting foods out, I mentioned it is quite a low carbohydrate diet. So what this means is, patients will need to be cutting back a lot of starches and sugary foods. So breads, rice, pastas, cereals, even fresh fruits, a lot of dairy they need to cut out as well. So a lot of these are quite nutritious options that they need to be avoiding. At the same time, they're cutting out sweets, processed snacks, fast foods, takeaway foods, sugary drinks. So a lot of that's going to come out of the diet as well.
Sure.
And so it does require cutting out a lot of these from food from food sources.
So what do they end up eating then?
Good question. So generally, when you start a very low energy diet, it is quite common to use the help of some formulated meal replacements.
Right.
Okay, so there are a lot out there on the market. Some are better than others, and I think this is where it's important that you pick one that is going to be formulated for this sort of process. Okay, so, because they're formulated in a way that's going to give you the right mix of carbohydrate, protein, and fat, as well as a whole host of vitamins and minerals. Okay, so generally you'll use 2 of those to replace your meals, and then you'll have a small protein-based meal as a third option as well. Remembering that throughout the day we are avoiding a lot of these carbohydrates. So it's quite interesting that 2 shakes, 2 meal replacements a day plus a third meal. It is quite effective in weight loss, but also suppressing that appetite. So that appetite suppression of ketosis is often helpful to keep people going on that protocol.
Right. Okay. So in your practice, what type of patients would you think would most benefit from this type of strategy?
So you really got to pick the patient appropriately. It's definitely not for everyone. It's definitely not one to start, for anyone who wants to lose weight. But I might see a patient who maybe has quite poor mobility, maybe some bad osteoarthritis in the knees, carrying a lot of excess weight and can't really exercise that well. So with this sort of protocol, it might be able to help them take off 10 to 15 kilos over a few months, and if that helps to move a little bit better, starts to get them mobilizing, then that can really give them a good head start. There's a lot of research with very low calorie diets in terms of improving health outcomes too. So there's a lot in the literature which suggests that these very low energy diets can be very effective for improving diabetes control. Okay, there's some really good studies to show that in early stages of diabetes, placing individuals on a very low energy diet can actually put diabetes into remission as well.
All right, so how long do you think like a patient can stay on one of these very low calorie diets?
I think it depends on the individual. I mean, if the strategy is to get them moving a little bit better so that they can get themselves to the gym pain free, then you might keep them on it for sort of I might keep them on it for sort of 6 to 10 weeks.
Yep.
For an individual that maybe needs to lose a lot of excess weight for an impending surgery, like
yep.
a knee replacement, or they're sort of having something done where the medical advice is to lose 30 kilos before that time frame, we might put them on them for a little bit longer. It's interesting, the very low energy diet, it's actually the protocol that we put on our patients before they end up having their bariatric surgery.
Oh, right, okay.
So we put them on that for between maybe 2 and 4 weeks.
Yep.
It actually helps with a little bit of excess weight loss, which is quite good, but the main thing is that it actually shrinks the size of the liver. So a lot of these patients coming in, they have quite an enlarged liver, fatty liver, and
yep.
it makes the surgical process a little bit more complicated. So we put them on this diet, shrinks the liver, makes their surgical outcomes a little bit safer as well.
Oh, nice. Perfect. Well, thank you again, Timmy, for coming on. If you guys have any questions for Timmy or any of our other specialists, please email us at admin@completehealthaustralia.com.au. Thank you again. See you next time. Thanks, Timmy.
Thanks, Ishan.